All right, so this drill is going to be especially important for those that when they go into this kind of overhead position out to the side here, they get pinchy right in this kind of mid-range here. So the biggest thing here is we want to make sure that when we are doing this, again, we are feeling it in the right spot. This should not be felt in the front of the shoulder. You might get a little bit on the side as long as it's not pinchy, but I definitely don't want you to get anything in this kind of upper trap neck area struggling up. So two pieces of equipment you can use here. You can use a TRX or you can use a band. If you watch my other videos on internal rotation and the external rotation isometrics, the band is going to be a little bit more challenging because it's going to want to pull you back in. TRX is a good place to start, but if you don't have it, that's fine. A band will do just as well. So going with the TRX first here. So I will typically start people with an open palm this way, so their thumb is out facing this way, and it's going to be right around their wrist. If that's too much for you, what you can do is you can move it up to mid-forearm. We're going to start at your wrist here. So I like to say start with your hand just to the side of your hip, take one step out. And that's the position we want to be in here, okay? So shoulder blade is down and back, and you're pushing out into the TRX. You're trying to do this movement here, okay? Pushing up and relax. So again, shoulder blade down and back. We're pushing out. We're not letting that shoulder blade shrug up like that. We're not letting our shoulder dump forward, keeping it right off the side of our hip, and we're pushing out. This should be felt primarily, if doing it correctly, right along the back of that shoulder and that posterior cuff, okay? So that's with the TRX. Now with the band, it's going to be the same position. So you might have to choke up on the band a little bit here. Step out just to the point where it's right at the side of your hip. Take one step in, and now you're in your position there. So shoulder blade is down and back, and essentially you want to be able to step in to the point where you have enough tension where it feels like it's starting to pull you in more than anything, okay? So that's pretty much right there for me. And I'm just holding that position. Again, this might be a little bit more challenging. This is definitely a little more challenging than the TRX version, okay? So 30 to 40% effort. You want to go for about 10-second hold. Again, that is going to be very important to do on a consistent basis for those that get pinching of that supraspinatus, that cuff tendon, as they move into that kind of mid-range position, or if they get pinchy overhead more than anything, to help keep that humeral head, which is the golf ball, off of the top of the shoulder.